Welcome to the Heads Up podcast, brought to you by the National Migraine Centre, the only UK charity treating headache and migraine. Visit our website to book your appointment with a world-class headache doctor wherever you are in the UK. There is no need for a referral. You can refer yourself. Our headache specialist doctors are looking forward to helping you soon.
Well, hello, everybody, and welcome to this episode of Heads Up Podcast. And we're talking again about cluster headache. Today, I am delighted to welcome back again somebody who was a guest on the podcast when we first did an episode on cluster headache, and that is Daisy. But with Daisy today, we have also another little visitor called Ned. He is 6 weeks old, and Daisy's going to talk to me today about how it was having cluster headache during pregnancy and now that Ned has arrived. Daisy, do you want to just introduce yourself a little bit and tell us about Ned and also Junie?
Yeah, so I'm Daisy. I have cluster headache. I have two little ones now. I have Junie, who is 2, and Ned on cue, who is 6 weeks old now.
So we may have a bit of a contribution from Ned.
Yeah.
He's just had a feed, but he's taking a little bit of time to settle down. But one of the questions that I'm going to be asking Daisy is, how is life with 2 small children and cluster headache? Now, I originally met Daisy when she was a patient at the National Migraine Centre with migraine. And then after we'd met each other for a couple of times, her headaches changed, and she additionally, unfortunately, developed cluster headache. And she is now, I'm very happy to say, a very keen advocate to raise awareness of cluster headache, partly by turning up at things like the Ouch Summer Conference, where she stood and represented the National Migraine Centre last summer, but also coming on the podcast. And she also works for our team. So thank you so much again, Daisy.
You're very welcome.
So you've had cluster headache over the years.
Yeah.
And yours has been episodic cluster headache?
Yeah, luckily, yeah.
So how often do you tend to have a bout if you aren't pregnant?
Yeah, if I'm not pregnant, it tends to be once, maybe twice a year. I've had a few years where I've had them sort of 6 months apart. Other than that, it tends to be sort of between 10 and 14 months apart, I've found.
Okay.
So yeah, it does change a little bit, but generally around similar sort of times. So usually around sort of winter into early spring for me, usually.
Right. Yeah.
And every now and then, yeah, like I said, I've had like a small sort of cycle in the summer a few times as well.
And when you have a bout, how long does it tend to last for you?
Anywhere from probably 2 weeks up to I think the longest I've had has been 6 weeks.
Okay. And do you get recurrent attacks during the day?
Yeah, absolutely. Anywhere from probably 2 up to I think maybe 8 attacks a day. During that cycle, yeah.
And I've asked other people with cluster headache, how do you function during an attack? Can anybody help you? Does it help if somebody strokes your head? How do you feel when you're actually in that acute attack?
Yeah, honestly, it's different every time. I used to always like someone with me, especially when I was younger, because I'd get a lot more sort of worried and panicky. Now I'm a bit older. I don't mind someone sort of sitting with me, but I don't really want any active help. A lot of the time, I like to sort of just sit and breathe through it and make horrific noises. Obviously, I do get very restless. Sometimes if it's one that doesn't seem to want to shift with oxygen, or sometimes I might need help with jabs if it gets, really, really awful. My partner does help me a lot with sort of getting the medication to me.
And you have family support, I know, with your mum and other members. So that can be really helpful, especially now having 2 children.
Yes, definitely. Yeah, I haven't had a cycle yet with Ned in tow as well, but probably will do within the next couple of months. Yeah, but no, I'm really lucky. I do have plenty of support around. I do have an aunt who is literally a neighbour as well, so I know that I can call on her at short notice if I'm here on my own with them.
Wow. It takes a little bit of planning when you're inbound
Yeah,
to be able
definitely.
to look after the kids. Well, up till
Yeah,
now, it's just been Junie, hasn't it? Yeah.
yeah, yeah. So the last cycle I had with her, I was pregnant with Ned, although I didn't know. Um, and yeah, it was a lot of unfortunately George sort of sticking her in front of her favourite telly program whilst I just get on with it. And a lot
Yeah.
of my attacks are in the night time as well, so I didn't usually have to have too many during the days with her.
Yeah. So
Yeah,
when you've become pregnant, how
yeah,
has that affected your cluster headache bouts?
yeah. So I do seem to have had a really severe bout at the start of each pregnancy. With Junie and with Ned, I did have a pregnancy that ended in miscarriage quite early, and I didn't have a cluster bout with that. So I don't know if it's a hormonal thing that was different in that one, and that also seems to set off the cluster bout. But yeah, very early on with both of them, like I say, before I actually found out,
Yeah.
I did have really very, very severe cluster bouts with them.
And was that at the time that you would have normally had a cluster bout, or was it a different time of year?
Um, it was a similar time of year, but not completely expected. Generally my bouts are somewhere between sort of, I'd say February to April.
Yeah.
With Junie especially, I had that bout in very early January,
Oh,
so it was a bit early.
yeah.
And with Ned it was March, so it could have been the usual one anyway, but
Yeah.
I did notice that they were more severe with more attacks
Okay.
each day. Yeah.
Did it last longer?
I'm not sure because I did have nerve blocks, so I don't know if it sort of
Yeah.
ended it.
Yeah.
Because I was pregnant, I was seen very quickly.
Uh-huh.
So I don't know if that's what ended them.
So I
Yeah, I'm not
know,
entirely sure.
Daisy, that you're under a specialist headache team, aren't
Yeah,
you, in a very good centre of excellence, and they know
yeah.
you well. And so you were able to contact them pretty
Mhm.
quickly by the sound of it.
Yeah,
Yeah.
yeah, they were fantastic. Just popping an email over to them and letting them know I was pregnant. I was seen, I think, both times sort of within a week. So really, really lucky with that.
And let's just talk about the oxygen and the sumatriptan.
Yeah,
Were you able to use the sumatriptan injections in your pregnancy?
yeah.
Yeah.
Yeah, so I asked you
Yeah.
and and my team as well, who both said yes, to go ahead, and definitely I'm so happy that I could, because it just makes such a massive difference in getting rid of the attacks a lot faster.
And you have oxygen at home.
Yes, I do, yeah.
Does
With
that
the
work well?
demand valve, yeah, definitely with the demand valve seems to work better as well. It will take longer than using sumatriptan injections for me,
Oh,
but of course it's sort of unlimited on how much I can use it.
yeah.
So I tend to find in the day I can use the oxygen a lot more effectively, because I can start it as soon as an attack starts.
Right.
Whereas in the night time, by the time I've woken up, it's already
Yeah.
sort of full blown.
Yeah.
So the oxygen will really take quite a long time.
Yeah. I know, Ned. Yeah. Thank you for your contribution.
Just wants to be in one position up here. I'll
Yeah.
just keep you here.
Okay. So you've used a mask before, have you? And then
Yeah,
switched onto a demand valve, and did you
yeah,
find that the demand valve was much more
yeah,
effective?
definitely, yeah,
It's also
yeah,
less wasteful of oxygen, isn't it? Because
yeah,
you're
absolutely,
getting
yeah,
it where you need it. Yeah.
yeah. And I just find it more comfortable too, because sometimes if I get into sort of very deep breathing or hyperventilating,
Mm.
oh, um, it's easier to use a demand valve, whereas using like the non-rebreather mask, sometimes you sort of use up all the oxygen within the bag more
Yeah.
quickly
Yeah.
than you actually want to be breathing.
Yeah.
So yeah, I've definitely found that a big help.
Okay. Have you had any problems getting hold of oxygen or sumatriptan injections?
No problems with oxygen, but I have had issues getting hold of sumatriptan injections. It's just something my GP isn't happy to prescribe.
Yeah.
So yeah, that has been quite an issue, unfortunately. I moved GP a while ago, and yeah, I need to change again, because the new one just
Yeah.
doesn't want to prescribe them. I don't
Just
think they have
doesn't
the
really.
understanding, really.
Yeah, doesn't have an understanding. I mean, I think that's one of the reasons why we're trying to raise awareness of cluster headache.
Yeah.
There are nice guidelines that are very clear about
Yeah.
prescribing of sumatriptan injections, sufficient quantities to last for a whole bout.
Yeah.
But there's
Yeah.
still this confusion, I think, between cluster headache and migraine. And
Definitely.
sumatriptan injections for migraine, and we give
Yep.
advice that triptan should only be used on 10 days in a month if you have
Yeah.
migraine.
Yeah.
But of course, that doesn't apply in the
No.
case of cluster headache, and it's much more important to get rid of the cluster headache attack
Yeah.
than to worry about overuse of the sumatriptan, which doesn't seem to be a problem with
Yeah.
cluster.
In one of the letters I had from my GP, because I'd sort of asked directly what the reasons were, and sort of sent them the advice from the NICE guidelines and things, and one of the replies actually said they weren't happy to prescribe it for cluster migraine, and I had to correct them that doesn't exist.
Well, that's exactly why we pull people up on that.
Yeah.
On that expression, cluster migraine, which just
Yeah.
is a totally confusing, misleading, non-existing condition.
Yeah. Very frustrating.
Yeah. So, during the pregnancy, you had multiple cranial nerve blocks, I think. Can you tell us a bit about what that was like and how well they worked?
Yeah, so I do find they work very well for me. I have found each time I've had them that I do have a bit of a worsening of the attacks for maybe a day or two, as well as really quite a severe just ongoing headache. But each time I think they've worked within a few days, and the cycle, the bout I'm in has really reduced or then ended.
Right.
So yeah, they've been great for me.
So those
Very
are
luckily.
local anesthetic, but not steroid. Is that right?
I think I possibly have the ones that are steroid for the normal gone block, but the rest of them are not.
Yeah, the
I
grade
think so.
triple nerve blocks sometimes
Yes.
have steroids in, and we often do that for patients with cluster. But I think the multiple cranial nerve blocks are
right. Yeah,
just a longer
anesthetic.
acting
Yeah.
anesthetic.
Amazing.
And did you have to have those more than once in each pregnancy, or did one set sort you out?
One set has sorted me out for each pregnancy. Yeah, I'm pretty lucky there. Yeah.
Yeah. Well, so that's good.
Yeah.
Did having cluster headache, how did you feel when you were thinking about starting a family, knowing that you had cluster headache? Did it affect you? Did you just think, well, I'm just going to go ahead and deal with it?
It used to really affect me, and I used to honestly think, especially when I suffered a lot more with migraine in between, I used to think that I wouldn't be able to handle it, and that it just would be too hard. And just again, as I've got older, and I have really lucky to have such great support with my family and my partner, so yeah, we just sort of realized it's something that's going to happen. And luckily I have really brilliant support medically and personally, so decided to go ahead. Yeah.
So how many years have you had cluster headache now? I can't remember.
So I think that it actually started possibly when I was 17, but I think I was 19 when you diagnosed me.
I remember that.
And I'm now 30, so
yeah, so been a
while.
A while. So going on from knowing that you're pregnant, you started having a cluster bout, had the multiple cranial nerve blocks, and then throughout the pregnancy, things settled down. But then I know you and I had a bit of a chat about how will it be if I have an attack during labor?
Yeah.
Did that happen?
No, thank goodness it didn't happen. I actually chatted with some people online just while I was worried, and did speak to a few people who it did happen for, and God, that just sounds awful. No, I was really lucky it didn't. At the end of my pregnancy with Junie, I think maybe a few weeks before I was due, I had a couple of very random attacks, just sort of 2 nights on the trot. So I really thought I'm back in another full-on bout, but it just didn't materialize. So I did look into it then and sort of spoke with my maternity unit and everything who were not very clued up at all.
Right.
So they'd sort of said if I want to take oxygen with me,
Yeah.
I'd need to go to a different place because I'd planned to give birth at a birthing centre. They said it'd need to be in hospital.
Uh-huh.
And that I'd need sort of a different birth plan. It might sort of be classed as high risk, and they might even want to do a C-section instead. So it was quite scary, and I do feel very lucky that it didn't materialise into that.
Can't imagine trying to have a C-section while you're
Yeah,
having a cluster attack.
yeah, and that's what I thought. Surely that's
Very challenging, doesn't it?
it really does sound terrifying. I was lucky in that it just didn't
Happen.
It calmed down a lot before I actually gave birth. Yeah.
And I know that you are partly breastfeeding Ned. Did you breastfeed Junie?
No, I didn't actually. It didn't work too well with Junie.
Okay.
No.
But you're managing, and
Yeah.
so Ned's only 6 weeks now, I think.
Yeah.
So breastfeeding hasn't affected what your cluster attacks or what you can use for your attacks if you should.
No, I can still use oxygen and sumatriptan.
Yeah. So one of the things I did preparing to talk to you today was have a little look at the latest papers on this for to guide us as clinicians. And there is a review article from 2021. And one of the things it says is, if you are a person with cluster headache and you're pregnant, close monitoring and collaboration between neurology and obstetrics are essential throughout pregnancy. So we need to be raising awareness, not just with neurologists, not just with GPs and the general population, but specifically with obstetricians. Who know about it. And I did do a recording some time ago on headache in pregnancy and breastfeeding. So if anybody is also concerned about migraine in pregnancy, they can certainly go back and have a listen to that one. One of the things I wanted to just flag up for listeners is that there are certain things that we do avoid if we know that people are going to become pregnant. And some of the things that we would normally use for migraine and possibly for cluster, we don't use in pregnancy. And those are the opioids like codeine. And codeine is not very good for migraine, not very good for cluster, can make things worse.
Definitely.
And yet there is this tendency of people who aren't very clued up to think, oh, this patient has got a very bad headache, so they need a very strong painkiller. Have you ever had codeine?
Yeah, before I was properly diagnosed and went to A&E for a really prolonged attack once and was given Oromorph. And it made things absolutely awful. That was I still would say that's probably the very worst cluster attack I've ever had, and I think it lasted 4 or 5 hours in a bright white hospital room. That was just awful. So I after that made sure to make sure I never got given that again. That definitely made things worse.
And there are other things, of course, that we sometimes use for cluster, which so usually we would use verapamil as a preventer. And that is okay with monitoring, obviously needs proper clinician monitoring, but things like lithium, topiramate, gabapentin, and some of the new monoclonal antibody injections, which we often use in migraine, but there's one that's licensed for cluster headache, are not advised in pregnancy, or even melatonin. So there are, obviously, if anybody's listening, they're planning a pregnancy, they know they have cluster headache, it's a really good idea to get seen by a headache specialist team, because they will know what you can safely use and what you can't. And the acute attacks, as we discussed earlier, oxygen and sumatriptan and zolmitriptan nasal spray are all fine to be using in pregnancy, as long as you haven't got any other contraindications for that. So I know that you are a member of Ouch, and you came with me to the Ouch Summer Conference. Have you found that they've given you useful support and good information?
Yeah, a couple of times I've had to call them, especially with the issue with my GP. Ouch have been pretty helpful with that, sort of given all the advice they can. Unfortunately, it's still not changed things, but they definitely were really helpful.
Yeah.
And there's some great resources on their website too,
Yeah.
especially if you're sort of writing to your GP and questioning
Yeah.
things. There's some really good resources that I've used on there.
Yeah. I think you're also a member of a Facebook forum that I'm a member
Yeah.
of as well, and
Yeah.
they also have some very good information.
Definitely, yeah.
So it's really worth looking for those kind of support.
Yeah, absolutely.
Information. So just coming back to you and the family, how is it? How do you think your family feel about the impact? I mean, what impact has it had on your husband and on your
Yeah,
dad?
I know that for my mum and dad especially, when I was younger, and I understand it now, I have children too, it must just be horrific for them to watch me going through attacks, because it's just so excruciatingly painful.
Yeah.
I know that, yeah, on my parents, that must have been really hard, but they're just amazing. And now I'm older too, I always sort of want to make sure they're okay in between. And same for Josh, my other half. He's great. He's so helpful, but it must just be, he always just says he just feels really helpless.
Yeah.
And it just must be stressful. And now obviously he's sort of got more to do when it's happening. Yeah, and even sort of during that bout, even out of attacks, it's hard to just function like normal, and I always try to, but there will be days where you've just had even less sleep than usual, and it really does take it out of you. And he's great in picking up my slack in the things that need doing, but I know that it must still be really emotional, really hard. I'd hate to see anyone that I love going through that pain. But yeah, I do feel very lucky that I have them. And
do you know anybody in your family who's had similar cluster headaches? And we know that migraine is a genetic condition, but I don't hear that so strongly with cluster headache. Anybody else you know?
I don't know if it's linked. I actually have a second cousin who does have cluster as well. Yeah, we are quite a migraine-y family. But yeah, just the one, bless her. And sort of, I think speaking to me helped her understand that that's what she has. And she actually came to see one of our doctors at NMC as well, to help with diagnosis there. So yeah, I don't know if that's linked though.
Remind our listeners that if anybody is concerned that they might have cluster headache, they can just refer themselves to our National Migraine Centre clinic by filling in the online booking form, and we will prioritise them and get them in as soon as possible, because we do know what the impact is.
Yeah.
So any messages for anybody who's thinking of getting pregnant or currently pregnant and who has cluster headache? Have you got any top tips?
Yeah, I would say just, of course, look into everything first, but I'm so happy that I did go ahead. I know that I am lucky to have the support I have, but the safe deliveries of my children was well worth it, and would do it all again. But yeah, it's so worth it. It's just, as with any sort of health conditions, planning is essential beforehand.
Yeah, I think that's very true. And also everybody's an individual, so they need to make sure. But a headache specialist team
definitely.
Really, really helpful.
Oh, absolutely, yeah.
Yeah. That's lovely. Well, thank you so much, Daisy and Ned. Ned is still wide awake, but he looks very interested in you.
Yeah, it's exciting, isn't it?
And I know that your children are a joy and a delight for you.
Yeah, they're wonderful. Bless them.
I've seen you really enjoying having a family, a growing family. So thank you for taking the time to do the podcast.
So much.
And hopefully the bout that may or may not come in the spring will be shortly.
Yes, that would be nice. We shall see.
Thanks, Daisy.
Thank you.
Thank you for listening to the Heads Up podcast. Visit our website to book your appointment with a world-class headache doctor wherever you are in the UK. There is no need for a referral. You can refer yourself. Our headache specialist doctors are looking forward to helping you soon.